Okay, so for our first question, and first of all, welcome to the live, everybody. We're here at Jonesboro Pediatric Clinic. And for our first question, so can you tell us a bit about yourself and your journey as a nurse practitioner?
I can. I started in Jonesboro about 15 years ago, but growing up, I decided at about age 13, my dad died of lung cancer, and that put me on the path of wanting to help other people, and joined Health Occupations in high school, worked at a medical clinic in Stuttgart. When I graduated, went to the University of Arkansas at Fayetteville, did my undergraduate. Initially thought that I was going to go to medical school, and then paths changed and ended up going to nursing school at UAMS in Little Rock. Graduated from UAMS in 1991. Decided during the course of my education, did a preceptorship with a pediatrician, my cousin, Dr. Don Newton in Hot Springs. And that made me fall in love with kids. And then started working at Arkansas Children's Hospital during my internship as well as a student nurse. And that's where I decided I wanted to do pediatrics.
Awesome. So can you tell us about JPC, the clients you accept, and the services that you all offer?
I can. So JPC is a career high for me because I've always dreamed of having my own clinic. And when the opportunity afforded itself, and Integrity Medical Group, the consulting group, contacted me about joining partnership and making that dream come true, we decided to open a pediatric clinic and give Jonesboro another option for pediatric health care. So we started here in January. We've been open about 2.5 weeks, and freestanding independent pediatric clinic, seeing kids from newborn up to age 21. We want to bridge that gap between kids who graduate high school at 18, and we want to be able to see them until they have to find a new family practice doctor at 21. So we'll plan on seeing newborns all the way up to 21 and offering services, whether that be preventative health care for vaccines and checkups or sick visits. We want to provide all of those things.
Okay, perfect. So what are your weekday and weekend hours?
So our weekdays are 8 to 5, Monday through Friday. I'm independent in the clinic, so it's just me. So as of the time being, we don't have weekend hours. We hope that will change in the future, but as of now, we're Monday through Friday, 8 to 5.
Okay. So what if someone needs help after hours? What do you recommend?
So after hours, we are going to try to refer those parents to urgent care if it's an urgent problem. If it's an emergency, of course, we want to refer them to either of the local emergency rooms, because that is, of course, something that their decision, we want that to be a safe decision. Mm-hmm. So whether that be St. Bernard's or NEA, whichever hospital they prefer, we want you to seek emergency care. But for the after hours parents who are concerned, if that's a sick concern, or like a Motrin or a Tylenol dosage, we want to refer them to our website. We're going to try to have a lot of information for those simple questions on our website. If it's a problem, say after a well checkup and they've had vaccines, those questions are also going to be a lot of our information and educational things that we give to parents. So we hope some of those questions will be answered without having to call or have those concerns at night. Or even if it's a sick visit, if I've seen a child for a particular illness, I hope I'm answering those questions, and I hope we're doing a good job at the visit, so some of those questions and concerns or worries are answered on the front end, and that they know what to expect. So when to worry and when not to worry. We hope we're doing our job answering those questions in the office.
Mm-hmm. So I know a big concern or question for most parents would be, what types of insurances do you all take?
We take Blue Cross Blue Shield, Cigna, Health Advantage, United, Just about every plan we've been credentialed through. We're working on our kids, and hopefully we'll have that up and going in about 30 days, but that takes a little longer. And so most private payers and most commercial insurances we're in network with.
Okay. And one of my last questions would be, what would you say are the best qualities about Jonesboro Pediatric Clinic?
So the reason I think our clinic is unique is it's a very small clinic. It's an intimate clinic, and we want to be on a first name basis with our patients. We want to know those families, their siblings. We want to take good care of them and know that they know we are familiar with their family. So that personalized care we want to offer, we want them to feel like this is the place they can come in sickness and in health. And we want to take care of them like we take care of our own kids.
Awesome. And so lastly, when can we expect the big grand opening?
February 28th is the tentative date. We're still working out a few kinks, but we hope for February 28th to be our grand opening.
Okay, perfect. Thank you so much for your time.
You're welcome.
And thanks to you all for tuning in.
Thank you.